Hi everyone, I'm Raven Roth and this is my presentation on generalized anxiety disorder. One of our texts had a really great first sentence when describing beginning the anxiety chapters, which is anxiety is a normal human emotion that is often adaptive and is recognized as an anticipation of a prospective threat. I think that, normalizing anxiety in general, I think that's going to be really important when working with people who have anxiety, even if it's not to the point of a mental disorder. Here's a few little descriptions of what anxiety disorders consist of. Anxiety disorders include disorders that share features of the excessive fear and anxiety and related behavioral disturbances. Anxiety is the anticipation of a future threat, whereas fear is the emotional response to real or perceived imminent threats. I think it was kind of important for me to kind of distinguish, what anxiety is, what fear is, worry, and stress. So I thought those were two important ones to kind of understand what it means, like when looking at the criteria and symptoms and all of that. Anxiety disorders differ from the developmentally normal fear or anxiety by being excessive or persisting beyond developmentally appropriate periods. So like going back to that first quote, anxiety is a normal human emotion, but it becomes problematic once it goes beyond appropriate periods. That's duration, frequency, intensity, and kind of interferes with everyday functioning. There are a bunch of different types of anxiety disorders. I didn't give descriptions of them all just because I felt like that would take a while, but separation anxiety, and I kind of put these in the same, the DSM puts them in chronological order where they kind of appear in individuals' lives. So, like separation anxiety is, seen early on. Not that this is the case for everybody, but most frequently. So selective mutism, which is the consistent failure to speak in specific social settings. Specific phobia, so a specific object or situation causes someone anxiety, worry, or fear. Social anxiety disorder, panic disorder, which is recurrent unexpected panic attacks, which is kind of one of the cases we looked at this week. Agoraphobia, fear of anxiety about being in two or more spaces, so like maybe a train or an airplane or large crowds waiting in line. And then substance medication-induced anxiety disorder due to other medical conditions. And then general anxiety disorder, which is what my main focus is going to be today for the rest of the presentation. Generalized anxiety disorder, as described by the DSM-5, is these are kind of more or less the criteria that they would meet. I'm not going to go through all of them just because we kind of looked at them this week in our text, but the major feature of GAD is excessive anxiety and worry about a number of events in which the intensity, duration, frequency is out of proportion to the actual likelihood or impact of the anticipated event. And then here are some of the other diagnostic features or criteria. One that I thought was important to know is that on the anxiety associated with 3 or more of the following 6 symptoms, that's for adults, and in children, it just has to be one of the following 6 symptoms. And these criteria have to be met within the last 6 months, and also it's more often than not somebody is experiencing these symptoms. Here are a few little facts that I found interesting about generalized anxiety, which are women are twice as likely as men to experience generalized anxiety. Individuals of European descent tend to experience it more frequently than other non-European individuals. And general anxiety is more commonly reported in individuals in developed countries than non-developed countries. I found that to be interesting. But then again, I always wonder, is that because we seek help in developed countries more because there is help available, and so maybe it's not reported as much because there's lack of sources to report it to, or to get it taken care of. And then also 1/3 of the risk of experiencing general anxiety disorder is genetic. So these kind of facts and just the whole anxiety in general, the 1 Peter 5:7, cast all your anxieties on him because he cares for you. It's one of my favorite verses. I think even just in the day-to-day, in grad school, working full-time, or having kids, or trying to maintain a social life, I think this is a good one, because we all get a little too anxious sometimes, or a little too stressed out, and we have to remember that Christ is there for us and that we can really rely on him in these times of need. So here are some possible treatment strategies for generalized anxiety disorder. So the first one is cognitive behavioral therapy, which is the most effective according to our text selecting effective treatments. It works on 2 goals, which are cognitive restructuring and reducing symptoms of anxiety by relaxation techniques, which almost all, besides the medication one, kind of went back to working on relaxation and, just being mindful. So I felt like these all 3 really well went together, and I couldn't see a whole lot of one happening without kind of integrating one of the others. And so mindfulness, I put down 2 different kinds that I found to be common amongst the articles that I found in a couple of our texts, which is MBSR is mindful-based stress reduction, and then MBCT, mindfulness cognitive therapy. And this works on cognitive strategies specifically to reduce tension, worry, and rumination of the core symptoms of anxiety. So that's like the restlessness, the fear, like the buildup, the anticipation of, events that, are perceived to happen. And then applied relaxation. And so one of the articles I'm using for my term paper is like really about this, and this is like what the article is about. And so it works on, it's like progressive muscle. So that's like, squeezing your hands and then fill it in your shoulders and fill it in your core, fill it in your legs, and it just goes down. And so it works on 16 muscle groups, and it develops a skill that individuals with GAD can practice and apply in daily life. So this gives them, a strong coping skill that they can really use anywhere, and they don't need any kind of tools or anything. It's just, they can do it in the moment. They can step away and do it if they don't feel comfortable doing it right where they're at, but it is something that they could do right where they're at, almost at any point. And then obviously there's medications, and a lot of them, a lot of the articles I found in our text say that people with anxiety tend to go to medical doctors first before seeking out counseling or therapists or psychologists. And so they are getting medicines a lot of times for antidepressants, which is the most common comorbid disorder to have along with anxiety. And so a lot of times antidepressants are prescribed, and then also anti-anxiety. So this is something that, the people that go straight to their medical doctor aren't getting the benefit of finding strategies that they can do on their own. Instead, they're having to only rely on medication. And so I think there would be I think there is probably a good balance, but I think that it would be more beneficial to maybe start with a mental health professional when it comes to this, and then have them work with a medical professional if medication is needed. And then this is another verse that I kind of just think really fits anxiety in general. And so it's Proverbs 3:5. through 6. Trust in the Lord with all your heart and lean not on your own understanding. In all your ways, submit to him, and he will make your path straight again. And I think this is a really good verse for anybody who is kind of questioning and, you know, worrying about what am I doing, where am I going in life. And, you know, we have to remember that it's not our plan, and, you know, he's putting us in situations because he knows we can get through them. And so I think this just goes with it. Anxiety in general is just, you know, we're not the way of the world, but he, you know, he determines our path. So thought that was a fitting verse to set in here. And then here are my references. Thank you all for watching.